This procedure was performed after the patient suffered an infection following bunion surgery. In order to verify adequate perfusion into the area of the proposed flap, this first SPY image was taken of the left forearm. The fluorescing agent was administered through a peripheral IV. We see the tip of a pair of forceps pointing to a bright area of fluorescence, which is the result of the underlying radial perforator. As the surgeon pans the camera, we see excellent perfusion throughout the forearm and hand. After the dissection was completed, but while the flap was still in situ, the fluorescing agent was again injected and another SPY image was captured. For orientation purposes, the elbow would be off the left side of the screen with the distal tip of the flap nearer the wrist. As the surgeon pans over the flap, we see good fluorescence throughout, except for the proximal tip, which remained relatively dark. As the surgeon lifts the proximal end of the flap, we see flow through radial artery. Following another injection of the fluorescing agent, this SPY image shows the completed flap to the great toe after skin incision closure. The tip of the great toe is off the right side of the screen. We see the surrounding tissue of the toe fluoresce first, then fluorescence of the newly placed flap. As the surgeon pans the camera, we see excellent perfusion to the tip of the toe and nail bed, as well as increasing fluorescence throughout the flap. Perfusion to the proximal tip of the flap appeared slightly diminished, but proved to be non-problematic.